We have an epidemic of huge proportion in this country, both with addiction and mental illness.
The suffering that folks and their families experience in the context of mental health and substance use problems is intense. And I think it's a kind of suffering that all of us who are treatment providers can empathize with and perhaps have experienced even in our own lives or our families' lives. In 2022, we're seeing combinations of substances that we never really thought of 4, 5, 6 years ago. Individuals who are using methamphetamine and also the super potent opioid fentanyl. There is a vast access to internet, the dark net, providing substances, exotic benzodiazepines, hallucinogens, opioids, and so on that were never available before.
I really felt like, based on my own family's experience going through several treatment programs in a fairly short period of time, that there was an opportunity to set a higher standard of care in the United States. My mission and vision for Constellation was to create centers of excellence in this country, treating a spectrum of addiction and mental health disorders, providing the highest level of clinical care for our patients, treating people as human beings with kindness, with empathy.
Our intention as an organization has been to develop a system of care and a platform for treatment across the mental health spectrum so that regardless of what a person's needs are, we have a tailored approach that will meet their needs. And that will occur across the current settings that we have in our platform, where we have Alta Mira in Sausalito and Bridges to Recovery down in Beverly Hills in the Los Angeles area, and then BrightQuest facilities in San Diego and Nashville. Across those settings, our intention is to get a really strong sense of what our clients' needs are and to be able to have the right place for them to step into that will be comprehensive in how we tailor treatment to meet those needs.
It was important to me to build a behavioral health system that was rooted in science, treating addiction and other mental health illnesses as a brain disease, which is what it is. So it's very important to me that we had a medical component, a neuroscience component to the programs that we offer, and those are all integrated into all of our programs today.
In addition to all these specifics, the exam, the labs, the history, the testing, imaging, genomics, etc., nothing replaces careful clinical observation during the course of treatment to really get an adequate view of what our patients are experiencing in terms of their mental health pathology and what we're seeing in terms of response to treatment.
Helping people find their path through those conditions to health and healing requires a real comprehensive approach, and I think that's something that's been really impactful for me in shaping the scope of the work that I do, that we do as a team and an organization. It has impressed upon me how fundamentally important it is to just have a really comprehensive approach to care, really strongly integrated teams working in sync together to help people find their path.
It was also very important to me that our programs were rooted in ethics and values, rooting the program in empathy and compassion, because these people are coming to us at their absolute bottom. And they don't just need the clinical services that we offer, they really need our love and compassion for what they've been through, without judgment.
The willingness a client and a family have to entrust us with their care is something that I take very seriously, my commitment to that. I think that's true across our organization, and to be able to assure every single person that in the scope of our work, we are going to see your presence in our program as an opportunity that you've created for yourself, and not to take that for granted, and not to treat that as one of potentially many steps on the path, but to really help you make this a turning point in your life. And what we can do, what our commitments and responsibilities are, to bring everything possible across the scope of our teams and our services to help you, to help your loved one, to help you all achieve what it is that you're looking for through stepping into this type of a process and entering treatment.